Welcome, ladies and gentlemen, to episode 6 of Beyond the Surface, a psoriasis podcast. I am Sophia Lowy and I'm your host for today. The earlier episode have highlighted a number of challenges pertaining to treatment and financing the country has to address in terms of psoriatic care. This is the concluding episode that we have with Dr. Azrul, Consultant Dermatologist of Hospital Kuala Lumpur, Dr. Thiru, President of Psoriasis Association of Malaysia, Encik Azrul, CEO of Gallen Centre Health and Social Policy. Welcome on board.
Thank you,
Thank you.
Sophia.
Thank you for inviting us.
Great to be here.
Can you give us a snapshot where we are in terms of psoriatic management and the treatment, and where we wish to see ourselves in the future, a kind of inspirational goals? I will begin with Dr. Azrul, who will give us the public sector perspective on the issues of where we are and where we wish to go. Dr. Azrul.
Right, thank you, Sophia. So I will start the discussion first. So in terms of what the public sector and the government hospitals have been providing in the past, I think there's definitely an improvement. We are able to offer a lot more to our patients with psoriasis in the government hospitals. Probably I just highlight that we now actually has a clinical practice guidelines on the management of psoriasis. The first edition was published more than 10 years ago, and we are actually in the process of updating. So hopefully by end of next year or early 2025, we are able to see the latest guideline, what are the appropriate treatment depending on the patient's severity. So hopefully with the guideline being available, it can actually help to aid the doctor in terms of managing patients with psoriasis. And the other thing also, we are able to have more dermatologists. I think most of you who are psoriasis warriors themselves will probably find it a bit difficult to get appointment to see dermatologists in the past because the number are very low. But with continuous training, we actually have more dermatologists in Malaysia now, both in government and also private sector. But we hope to produce more. But there's still some disparity in terms of the number of dermatologists in the urban and also in the rural area. Definitely in the urban area, there are more dermatologists, and getting access to dermatologists is much better for patients in the urban area. But in the rural area, we do not have as many dermatologists, but we hope we are able to put more dermatologists in those areas, because we want to create equal opportunities for patients.
Thank you, Dr. Azrul. Okay, now Encik Azrul, you have highlighted in Gallen Centre white paper on psoriasis. Now, as a number of areas where the country needs to pay attention in order to improve psoriatic treatment and patient care, perhaps you may wish to share with viewers on these points.
Thank you, Sophia. You know, one of the primary issues that we've raised in the white paper is really the concern that a lot of undiagnosed cases of psoriasis in different forms of psoriasis, and that basically what we are wanting to be able to always be able to do is to diagnose as early as possible for a person, whether it's a child or an adult, and to be able to link them up with the appropriate treatment. And so very often we focus on the treatment side of things, but very often in the case of something like psoriasis, which is a long-term chronic condition, you want to be able to get them much early on so that the best possible options are available to them. And so the emphasis here is on healthcare professionals, healthcare providers who are able to do that. I think it was mentioned just now by Dr. Azrul on the necessity of ensuring that the private and public dermatologists are available to be able to diagnose. And in Malaysia's case, because majority of the population are really accessing the public sector, it is something of concern that they may not be able to meet the appropriate specialists in the duration of time that's available. So that is a concern. And you know, the question would also be like, how do we involve GPs, for example? Do we have to go straight to a dermatologist in order for us to be able to diagnose the condition? Can we involve GPs to be educated, made aware and informed, and to ensure that they have the knowledge to do that? And then there's the issue here is concerning the availability. Once you've gotten them diagnosed, are there treatments available? And so with Malaysia, it's been a little bit slow, in our opinion, going, but we're getting there, which is good, because I think in the past couple of years there's been more advancement in the issue of psoriasis than there has been much earlier on. And a lot of the work of Dr. Azrul's colleagues, and a lot of it's from HKL, I think, has been that, you know, we're moving away from topical creams, coal tar treatments and all that, you know, and basically that being the standard to much more advanced systemic treatments which are able to react faster. But again, it goes back to how quickly can a person get diagnosed and linked up with that. And one of the concerns we've also raised in the white paper is concerning patients themselves. There's a lot of emphasis concerning treatments, there's a lot of emphasis on healthcare providers, but when we talk about patients, and this is where getting the input from patients themselves is very important when you're trying to ascertain the effectiveness and whether you've made an impact, whether there's a good outcome. And when you ask patients, sometimes patients, like all of us being human, there is a gap between what the doctor says and what the patient expects. And it's important to manage that, because patients may expect a quick result, you know, after years of suffering, a lot of pain, a lot of deterioration in the quality of life, unable to work, unable to move limbs and so forth. And so when given the possibility of treatment, the thinking is, I've gotten screened, I've got diagnosed, I've got to speak to the right doctors, I'm on treatment, can I get a result very, very quickly? And sometimes there's a lot of frustration there, because people are concerned that, you know, I'm spending a lot of money. Sometimes some of this involves a lot of money as well. It's not cheap. It's even though it's subsidized, maybe there is some other non-medical expenditure that's involved. So you want to be able to get a quick result. But very often, it takes a certain amount of time, you know, before we can get that kind of expectation, meeting the expectation of patients. So asking them, what is the quality of life that you want to, how do you scale? You know, so there are instruments that we measure when it comes to psoriasis to be able to ascertain whether or not whatever treatment, whatever support, assistance that the healthcare professional is giving, whatever the environment for treatment is being provided to the patients is working, you know, and it all boils back down to the patients themselves. We have to listen, we have to respond, and most importantly, we have to find a middle ground there to ensure that treatment is realistic, expectations are as best as possible, you know, within a certain time frame, and most importantly, imagine a patient who maybe a couple of months ago was not able to step out the house because of limbs hurting, a lot of pain, there's a lot of suffering, cannot even touch the surface of the skin. A few months later, is able to get out, socialize, meet with people, you know, and maybe in the not so distant future, even to start thinking about having a normal life of working, being productive members of society again. So these are some of the issues that we've raised in the white paper, and we're hoping that there will be a lot of interest in the stakeholders, the policymakers to adopt some of these recommendations.
Right. Yeah, I think it's interesting that you mentioned just now about agreeing to the endpoint. Sometimes the healthcare practitioner's target is different from the patient's target, because they may want a quick fix, something that can work fast, but at the same time, you have to take safety into consideration. Some patients, they are not even bothered by a few patches here and there. Some, they want the skin to be like totally clear. So different patients, they will have like this different expectations. So we have to reach to a mutual agreement. What is your expectation and what is my expectation, so that the end line is actually the same there.
But is it a practice now that doctors at the outset itself ask, we have kind of agreement with the patients, look, this is what we can really deliver. And do they have this kind of discussion, expectation kind of management kind of discussion?
Well, ideally, that should be the way. Usually we will assess the severity of the patient's condition, and we will list out what would be the best treatment option, because there may be several treatment options, and in the end, it depends on the agreement between the healthcare practitioner and also the patients to balance between which would be the best treatment. Because I may think that, for example, biologic would be the best for you, but you may be scared of the needle, you may not have the means to purchase a biologic, and then, or maybe I think an oral treatment is best for you, but at the same time, let's say if you're a woman, if you feel that you want to start a family, it may not be a suitable treatment option for you. So both of us have to agree. And some patients are okay with a few patches here and there. Some, they want the skin to be clear within 1 or 2 months. Okay, so all those goals we need to tabulate, and we need to, both parties need to agree. Because in the end, we want the treatment that is provided is tailored to individual patients. Because your treatment regime may be different from yours. You probably would not mind you probably will not mind being in remission. The duration to being to remission takes longer compared to one patient who wanted the remission to be immediate. Yeah, so I think every individual is different.
But Sophia, these are many issues linked back to a fundamental concern, which is stigma and discrimination, because a lot of people living with psoriasis face a lot of discrimination.
Yes.
And the reason being exactly what Dr. Azrul said just now in terms of, the manifestation, the physical manifestation of psoriasis, when people don't really understand what they're seeing, you have patches of scaly skin, or there seems to be some form of flaking, and they start thinking that, is this an infectious disease? People who are not informed, and they think that maybe this is something that is contagious, that perhaps this person being in a working environment, despite not having any pain, but having these manifestations, are considered a danger for other people. So, a lot of those concerns, the insecurities, the fears of patients with psoriasis is linked back to the expectation question that we raised issue, because people obviously want clear skin. I mean, that ultimately is the objective. That's what people want. Not even a small patch even, because if somebody sees a small patch, somebody's going to ask, nyebok, right? They ask, what is that and all that. And then you somehow got to explain. So the issue here is really how do we address all that so that when we look at an outcome where you see a person living with psoriasis, who is it really an outcome of, say, when people see a person who's totally clear, the outcome, or is it an outcome where you see a person and the person has some patches of skin that seem to be inflamed, or maybe flaking or some other, but it's all right because they understand what that is, and there is no fear. So there are two possible outcomes here that we want to be able to see, and we need to understand. And it goes a long way to addressing the stigma if we have increased awareness from not just healthcare professionals, but also in terms of the public as well.
Awareness among public is very important because, as you correctly pointed out, there's still misconception thinking any skin disease, they are contagious. But psoriasis, as we already mentioned in the previous episodes, it's not a contagious skin disease, and you can't get psoriasis just by touching anyone with psoriasis.
I believe this is very interesting. I think we can keep talking, because it's a wide range of a topic of discussion. So thank you, Encik Azrul, and also Dr. Azrul. So coming back to Dr. Thiru, okay, in your own words, for example, in your point of view, what do you think patients' inspiration or aspirations are?
Well, thank you, Sophia. This is a very a great question. I mean, many patients that I've come across, they've expressed the view that they want to have very effective treatment. More than that, effective and affordable treatment. Azrul just mentioned about this thing about clear skin and things like that. This is very, very important for many patients. But as you have heard from, I think, from earlier episodes, that effective treatment, Dr. Azrul, we understand that is pretty expensive. One that is, we are talking of one that is talking of in the thousands.
Yeah, but
and
not all
in-
patients would require biologics. But
I
if
know.
yes, if they require biologics, it is very expensive.
But,
Yeah.
but something like about 20-30% of the patients who are quite severe, moderate to severe, they may require some stronger. But Azrul, many of the patients they want the most expensive treatment that guarantees them clear skin. So this is the aspirational goals of the patients, But whether we in Malaysia we can satisfy that, that's another part. We try to achieve that. The other thing that they have been telling us is that I think this is about the waiting time to see a specialist, but I think this applies more to in the case of people coming from rural areas. Like Dr. Azrul mentioned earlier that most of the dermatologists and rheumatologists are actually in the major towns of the country. But we are doing. The government is doing very much, but there's also a problem that some of these people do not want to go to posting, but they're doing very much more than what we saw in 2 or 3 decades ago. These are the two key problems so far that we get this feedback of waiting time. But more often than not, we get this problem of the cost of the treatment, and this is something that we are trying our very best in whatever way we can do to alleviate this problem. And recently we wrote into to EPF to say that can they withdraw money for this medical purpose. I was actually surprised that psoriatic arthritis is there in the list, but psoriasis or but this is they are using their members' money actually. More than that is a point that both Azrul and Dr. Azrul you raised, that patients have also emphasized from now and frequently about the need to raise this awareness question. Many people went to seek jobs actually. They were actually frightened by employers saying that, I think you're having a very serious problem. We are going to be burdened by taking you on board actually. So there you are, and this is something that we really need to. If we can start this in the schools and the young, that there's nothing to be afraid of, and that we need to show a more humanistic side to students from young. I think we'll do a wonderful job actually on this. So this is how we see ourselves in playing that active role in discussions with the relevant ministries, in particular the Ministry of Health, to echo some of these sentiments that have been brought to our attention by our members and patients whom we get in touch with. Thank you.
If I could just pick up on the issue of cost and affordability. The reality is that unless you are under the Ministry of Health's program and being able to benefit from the subsidized treatment under there, very often you find that the availability of treatment could be determined by how much you can afford and the price of the treatment involved, whether it's biologics or some other. It's really dependent on how much money you have, and out-of-pocket payments for this condition are very common.
Yeah.
So you find that people are having to withdraw money from their savings to be able to sometimes gadai, their tanah or maybe gold, in order to get some of that. And it's not just about the treatment itself, but also about around the costs relating to the treatment that may not be subsidized. So you're going to have to deal with that as well. So, very often in cancer, we speak about financial catastrophe. And we don't talk enough about financial catastrophe for non-cancer related conditions. And when we say that, it means a third of household expenditure is spent on treatment, on medical treatment. So that's what we define as financial catastrophe. So very often for those who have insurance, the assumption is that your insurance should be able to cover. And therefore, you know,
but like what we discussed in the previous episode, it may not be covered,
may not cover.
because they only cover the inpatient treatment, but not the outpatient treatment.
And that's the worry there, because people do not know exactly what they have in terms of the insurance. You know, they go in expecting it will be covered, and then to find out that you need to be hospitalized, you need to be an inpatient, but very often these treatments are outpatient.
And when they're on the effective treatment, their skin is clear that they do not need to be hospitalized.
Exactly. So, but the cost is still there. But you have to still have that, you know. So, how then does one reconcile all this, you know? And does and a fundamental question that has not been answered by a lot of people, which is, does your health policy cover? And this is where a lot of us will start looking through our policies, you know, that thick document that's around 60 pages, you know, with very small writing on it. You're trying to figure out whether or not it's covered. And then you realize that, yes, it may be covered, but there's a lot of conditions attached to it. And this is where you end up with out-of-pocket payments, you know, that are being made. And so there is a need to understand the affordability aspect of it as well, and to see whether or not what we have today is able to also take into consideration some of those factors as well.
Right. Very well, you know, pointed out, because in my personal point of view, also my personal experience, I have no insurance coverage because simply because the psoriasis is not covered. You know, so most of the time I have to land into hospital, like government hospitals, because purely, you know, like public or even like private hospitals are not being covered. So that's also another financial burden that I went through. And thanks to, you know, Hospital Kuala Lumpur right now, because they have given a good coverage when it comes to psoriasis treatment and so on and so forth. Yeah, so that was very nicely pointed out on that manner. But now we know where we wish to go. But next is like a golden question. How do we get there? So probably I can ask Dr. Azrul, what is your point of view?
All right, so I think if we were to summarize, I think everybody would agree that creating awareness, reducing the stigma and discrimination, that would be the top priority. And I think Psoriasis Association of Malaysia has been doing a good job, and hopefully we are able to progress even more by, like you mentioned, going to the schools and educate the young children on what psoriasis is all about, that it's not contagious. Start them young and create more awareness by doing the program, by educating the public, and also so that those potential patients, when they realize that there's probably something going on, when they see all these patches, at least they seek the correct treatment. Rather than try supplements here and there. We would rather they know where to seek the appropriate treatment. Definitely, as you mentioned just now, there may be a problem in terms of getting access to treatment, and there is still a disparity between the access in the urban and also in the rural area. But hopefully with regular training, we're able to produce more dermatologists that can help to reduce the gap between the urban and also the rural areas. And of course, the other thing is we hope to get more funding so that we are able to treat more patients. I mean, they are deserving patients that we should be able to treat them with the appropriate treatment, but of course it needs funding. So hopefully we're able to come up with a national biologic funding that can actually guarantee a continuous treatment for these patients.
Right. Okay. Thank you, Dr. Azrul. So how about Encik Azrul?
It's a very tricky question to answer, really, because our ability to respond to conditions such as these is really dependent on how well we understand the condition. And it goes back to fundamentals, in this case data, in terms of prevalence. Basically the number of people living with psoriasis is the number that we have today, as we understand it, an underestimation. Is it an underreporting more likely, which is the case? And if it is so, what is the real number? And it's important to underline here that unlike certain conditions, certain diseases, which is notifiable, which is required by law to be reported to the Ministry of Health, so to speak. Conditions such as these are not. And therefore, you find that you may see a lot of private practitioners seeing a lot of patients coming forward to get treated, and they are nowhere in the numbers that are being reported by the Ministry of Health. It's not really due to anybody's fault, really. It's just the way it is, you know. And today we have numbers that come predominantly from the Ministry of Health and perhaps Ministry of Education side as well. And this is where you find that very often our ability to respond, especially from a policy perspective, is dependent on what is the size of the problem, who are they, where are they living, what kind of treatment is needed, etc., etc. And so we need to improve on that data that's available in Malaysia when it comes to psoriasis. And this is where we have tools like the National Registry for Psoriasis that we can make use of. We need to be able to improve on. And most importantly, I think, going back to the issue of healthcare providers as well, and the private sector especially, this is where they can contribute to this data availability. We need a systematic way where we don't need a piece of legislation to make it a requirement for them to report or perhaps include their cases into the national numbers, you know, so that essentially we have a better idea. And this is where policymakers at the Ministry of Health level, and also in terms of politicians and people who we really need their understanding to support, they need to know the actual situation so that we know when we are asking for a certain amount of money or funding or treatment to be approved, this is why we're asking, you know, and it helps when we have a better and improved picture concerning that. I mean, these are some of the recommendations that we put in our white paper on psoriasis, and it underlines the importance in any condition or disease that we're trying to respond from a public health perspective, that we have a better grip on the numbers that and the diversity of psoriasis even, you know, it's not homogeneous, you know, it's very important that one person is not the same as the next, and you can't apply the same solutions to one person that you apply to another person normally, and sometimes there is a need for specialized attention or much more specific treatments that may cost a little bit more money. And so it goes back to that data issue. The more that we know, the better we're able to respond.
I definitely agree with the data part, because a lot of countries, not only Malaysia, they are looking at the data because it plays a pivotal role, you know, in looking at the larger picture, you know. So thank you, Encik Azrul, for the insightful, you know, information. So how about Dr. Thiru, you know?
Thank you, Sophia, but I will just focus essentially from the standpoint of the psoriatic a national organization, and that is we hope that the powers that be, that mainly the Ministry of Health, would empower the respective associations, patient-centered associations. In this case, we are the Psoriatic Association of Malaysia, to empower them to carry out their duties so that they can serve the patients well, and support these organizations, engage with them, because in many instances, Ministry of Health is, has restrictions or has limitations in reaching out to the down the line. And so this is important. Health issues are not only comes under the purview of Ministry of Health. It is, as COVID-19 has reminded us, it is a whole of society kind of approach. And I think you have done a lot of reports on this, on the lessons learned from COVID and how it applies to us. And I think one thing that I think strikes me a lot about what governments can do for, in the case of a disease like psoriasis, is to work with all these stations as partners, and we can do many of the things that would improve the condition of the of the patients themselves, which in normal times would not be able to be reached out by Ministry of Health. You rightly say that, Azrul, that many of these patients do not even report that they are having this kind of problems. Many I know for a fact, we've got feedback. Some patients after 5 years they discover that they are having psoriasis. After 5 years. So can you imagine if we have a strong network of people working throughout the country, they'll be able to tell us some or many of these kind of problems, and I think we'll serve a better kind of system of health treatment, whereby the Ministry of Health, through their doctors and nurses, their community health nurses. Here we have got the patient organization together with their people down the line, working towards improving the state of condition of this. I think on that note, Sophia, this is what our aspirational goal would be, to see this working. Thank you.
Thank you, Dr. Thiru.
Can I just add on to Dr. Thiru's point there concerning the need to expand the involvement beyond just the Ministry of Health. And I think we don't emphasize this enough. Poor KKM, every time we just go to them, we're like, it's the same guys, and then we're expecting miracles.
Right.
We actually need to involve a lot more people, including the Ministry of Finance, the Ministry of Economics now, EPU has gone there now, and it's very important for us to involve non-Ministry of Health stakeholders here in the discussions concerning psoriasis, especially the Ministry of Women, Family Community Development, because it is a social issue. When we're talking about a lot of this expenditure in terms of providing treatment for people living with psoriasis, it's an investment actually, where we are looking at ensuring that these people who may, because of their condition, have removed themselves from society, from the workforce, because of the pain, because of the suffering that they've gone through, because of their needing to be treated. But if we are able to invest in the appropriate treatments, the effective treatments, that are able to produce results, when given to these people, they may, in very short period of time, be able to reach a certain level where they feel comfortable again about going back into society, to be able to work, to be productive, to take on jobs, and most importantly, I think for the government, to pay taxes, and so forth. So we look at this issue not just as a health issue, it's a form of investment to ensure that Malaysians are able to be healthy, to be able to be productive, and most importantly, for their around society as a whole, we talk about wellness. This is part of it, and that's why the Ministry of Finance, Ministry of Economy, and the Ministry of Women, Family, Community Development all need to be sitting at the same table when we talk about this, so that they can understand what does it mean that when we provide this treatment for these people, for them, how does it apply? How does it go back? What is the return of investment for that? And so it's important for us to move away from the siloed approach to health that we've taken, many years. And this is something that when we are moving forward for the next couple of years to come, health really needs to involve more than just the Ministry of Health.
Right, I totally agree with you, because I also personally believe that a patient's productivity will also lead to country's economy, productivity as well. So this is something that we have to look in a broader aspect. So thank you, Encik Azrul, very nicely pointed out actually. Thank you, Dr. Azura, Dr. Thiru, and Encik Azrul. Ladies and gentlemen, much more can be done to improve the lives and the estimated of 300 to 500,000 people living with psoriatic disease in Malaysia. They face social exclusion, stigma, and their lives are negatively impacted. Despite significant clinical advances, many are still underdiagnosed and even misdiagnosed, undertreated, and face numerous hurdles. But with sufficient resources and coordinated approach, the sufferings of the psoriatic community can be reduced, and they look forward to a better future. Join us in making this happen by giving us your support. Thank you for joining us in this final episode of Beyond the Surface, a Psoriasis podcast. It's been a pleasure Goodbye and take care.
Bye.